Hey, Dr. C here. Hope you're having a good day today. Today we're going to talk about screenings, health screenings. Now, that's not a physical exam. These are the screens that are usually done, maybe as a part of your physical, maybe not. But do you need all these screens? Now, this came into effect when the wellness concept came in. And the wellness concept was promoted by many people, including promotion from Medicare. You can get an annual wellness examination from your primary care person, paid for by Medicare. In fact, Medicare will actually pay a little more for the wellness exam than they will for the annual physical examination. No physical is done as part of that wellness exam. This is done for prevention of possible further complications in the future. That's what it is. It's trying to prevent problems. And that's really what a lot of these screenings are for. The purpose is to try to prevent something serious from happening in the future. And so let's talk about these screens and what you should have, what is covered, what is recommended, what you should have, what is probably not worth it. Okay, let's start at the top. Aneurysms. So screening is done for abdominal aortic aneurysms. What is an aneurysm? It's a weakness in the wall of the artery. Now, obviously, the aorta is the biggest blood vessel, and so if that aneurysm expands up more than 5.5 centimeters, which is about roughly a little 2¼ inches, you're a candidate, basically, for some treatment for it to try to prevent it from rupturing. Because if an aorta ruptures, you're in deep trouble. Deep trouble. So, should you get an ultrasound, which is basically what the screening technique is, an ultrasound of your abdomen to look at the size of your aorta. Now, this whole thing is ridiculous to me. What we used to do, and what I still did right up to the time when I retired from that, is I would just have them lie onto a side, and I could actually feel the aorta. What the hell do I need to get an ultrasound to tell me that something is a centimeter larger or whatever? The whole thing kind of gets you away from hands-on type medicine. We're getting totally away from hands-on medicine. And the aneurysm thing is one of them. Now, you have to be, if you are age 65, you are qualified to have an ultrasound of your abdominal aorta. So, but you also, especially, you can get it done younger if you have a history of smoking, hypertension, and your age. Those are basically the simple criteria for having that done. So, if that aorta is up to 3.5, 3.7 centimeters, it's normal size. One shot only, you only get the one-time ultrasound. So, and I told you what would happen if it's over 5.5. Now, that's not the only place that gets an aneurysm, so why not look elsewhere? Well, because nonsense. You can get aneurysms of any artery, any. You can get an aneurysm, for example, of the artery that goes to the kidneys. You can get an aneurysm, the artery goes to the liver. You can get an aneurysm going to the spleen. You can get an aneurysm in the groins, the femoral arteries. You can get an aneurysm in the popliteal arteries, the one that's in back of the knee. All these places can have aneurysms, but the incidence is low. And it usually occurs in the elderly. And remember, and I have plenty of argument about all of the things that are prejudice against the elderly, and that is one. That's one. Okay, let's go on from abdominal aortic aneurysm. Let's talk about mammograms. Now, I'm not just sticking to men alone, because it's the men that usually get the aneurysms. What about the mammograms now? That goes through a flux all the time. Every couple of years, they seem to change a little bit on when you should get an aneurysm. And the other issue is that there are different organizations that have criteria for when you should get a mammogram. For example, USPSTF, that is the United States Preventative Services Task Force. They have indications for all of these different tests and all. Well, also the American College of Surgeons has their criteria for the getting a mammogram or not. Nowadays, the age has come down a little bit. It's now age 45 to 54, you should get an annual mammogram. I've seen it now down to age 40 because we're now seeing some younger women with breast cancer as well. Now, over 55 to 74, you can get it every other year. Most of the insurances will cover it every other year. Over age 75, you don't need it anymore. For Christ's sakes. Our age is going up every year. We're getting older, let's face it. And again, prejudice against the elderly. Nothing over 75 is covered by insurance. Okay. And the other thing that really ticked me off with this mammogram thing, with the screens and all, they don't even recommend that the breast get examined. A physical examination of the breast. I couldn't believe it when I saw that. But yeah, I should believe it because people are idiots now who are calling for these types of things. They're getting totally away from any hands-on type examinations anymore. You got to have it done with a machine. And that's what it's going to come to in the future. We're going to have artificial intelligence doing all of our exams. Okay, that's enough for mammograms. It's driving me crazy. Okay. Also now, carotid arteries. Now, what is the big deal about carotid arteries? Well, remember we had a talk on atherosclerosis, narrowing of the artery, depositing of cholesterol-like material, and gradually narrowing that artery down. Now, what is an ultrasound of the carotid artery? Why are they doing that? They can do ultrasounds of any artery, but why the carotids? They do that because there's a certain incidence of stroke. Because if you narrow that artery down to 75 to 80% of that circumference, you will be in danger of a stroke. Because at that point, 75 to 80% narrowed, you get a decrease in the blood flow, decrease in oxygen going to the brain. But that's not the only cause for strokes. You can also get an ulcerating plaque. One of these little plaques breaks open and a little ulcer forms inside. And that ulcer fills with platelets, and those platelets then are sort of like oatmeal, and they can break off and go to the brain, cause a stroke. So it's not only the narrowing that counts. The problem with getting the carotid arteries looked at is because you can get narrowing, say you got 40, 50% narrowing, and they let you know you got 50% narrowing. Well, all of a sudden, holy crap, I got 50% narrowing. I'm going to have a stroke, or it gets you all nerved up. Oh, I got to get that test done another year, It drives you nuts. So if you have no symptoms, basically, like a TIA, a transient ischemic attack, no symptoms whatsoever, you don't need to have the carotid arteries ultrasounded. Okay, so, and that, remember, is also that carotid artery and the aorta. Those are both part of a place called Lifeline. they go all over and they will do all of these so-called screening tests to protect you. So okay, but that's the carotid artery at any rate. They can also test for peripheral vascular disease, which is usually in the legs, because that femoral artery can plug up. Now, that doesn't mean that you're going to have symptoms. So should you have the arteries in the legs checked as you get older? Well, the people who are in the know, and I'll say, no, you don't, unless you have symptoms. What are the symptoms? Symptoms: claudication, pain in the calves of the legs, usually after a particular time of walking. So claudication is pain in the calves. If they go further, you may get called rest pain, pain in the calves when you're not walking, just at rest. That's even worse. So if you don't have those symptoms, you don't need to get the vasculature in the legs checked out by ultrasound. What else? Obviously, they check your vital signs when you come in. Anytime you come into the office, they check your blood pressure. Now, we've had a talk on blood pressure, and you know from what I've told you that blood pressure in a doctor's office is probably the worst place that you can get the blood pressure done. Number one, most of the time it's not even done by the doctor. It's done very quickly after you come into the office. They don't check. They take it right over your clothes and all. They don't check to see that your feet are planted flat on the floor. All these different things. You can talk while it's doing it. Remember, that also decreases the damn blood pressure too. So all these different things are not done in the office. The best place to determine whether you need to be treated for blood pressure is at home. You need to get that home, follow it every day at a particular time of the day, and see what's happening to that blood pressure. Now, that worried the companies that are making all these pills, of course. So what they did is they lowered the standards for blood pressure. Oh, that did a lot of good, didn't it, huh? Okay. So weight too. Simple. Oh, they weigh you. What? Yeah, but they're not doing anything about it. 60% of people are overweight in the United States. What are they doing about it? Oh, you go to the gym. Bull. Total bull. Do something about it. Put people on a particular diet. Regiment them. Make sure that they're following things. Absolutely ridiculous. Okay, what about cholesterol? Lipid profile, they call it. Lipid profile. Yeah, they do check the total cholesterol, but unless that total cholesterol is off the charts, way over 250, like 400, 500, unless it's like that, total cholesterol doesn't really mean an awful lot. What's important is the high density and low density lipoproteins. That carries the cholesterol. That's the thing that's important. And so it is important to get screened for your lipid profile. Now, that USPSTF, they say that you should have that screened on an annual basis after age 40. Now, you should have it done earlier if you have a positive family history of high cholesterol or high lipids. Okay, so that is the lipid profile. What about colonoscopies? Oh, God, everybody seems very nervous about getting their colonoscopy done. What do these task forces say about when you should get colonoscopy? Well, you should start usually about age 45. And even that now is starting to come down a little bit because we're picking up colon cancer at a younger age now. Some of them are coming down to age 40. And you should have it done every 10 years if the last one was negative. If it's positive, you should have it done in 5 years. Okay. Now, what do I mean by positive? That means they took a little polyp out but wasn't cancerous. Because cancers do happen from those little polyps that then turn into the cancers itself. So What about this Cologuard? What is the deal with that? Well, we used to do what they call stool guaiacs. Basically, you take a little finger sample of the stool and you put this guaiac solution on it. And if it turned blue, it was positive. That it reacted with blood in the stool. Well, this is basically what the Cologuard does. They test for blood, and they also test for a marker, a cancer marker. Basically, the marker is the DNA of a cancer cell. And so they test for both of those. That's what the Cologuard does. Now, Cologuard advertises that they can pick up to 92% of cancers. I don't know if that's accurate or not, but that's what they advertise. The only thing about the Cologuard is that they'll send a kit to your house. You have to supply the stool and all, send it back in the kit, and then they would analyze it. Not all of the insurances cover the Cologuard. So you have to, if you want the Cologuard, you have to ask your insurance first, because it costs you a couple $100 to get that Cologuard kit. Okay. What else? Well, there are people now who will do whole body CAT scans. What's the story with these whole body CAT scans? Well, first of all, I should tell you that no reputable medical organization will tell you that you have to have a whole body CAT scan. Why? What are they looking for God's sakes? Well, they're hoping they can pick up some cancers. Well, it's very, very limited, the number that they pick up. You really don't need to get a total body CAT scan, and you shouldn't anyway, because of the amount of radiation you're getting from that CAT scan. So the yield is small, but the radiation is big. So don't get fooled into doing that. There are also people who tell you need to get a heart scan to look at the amount of calcium that's in your coronary arteries. They call that a CT calcium scan. Should you get that? Well, again, remember I told you about the carotid arteries and all? You get a progressive narrowing. For example, I think if I had mine right now, and I'm 83, if I had mine now, I'd have a certain degree of narrowing, not only in the carotid arteries, but also in the coronary arteries, because they're about the same size arteries, okay? So, if I had a 50% narrowing in one of the three major coronary vessels, I would be nervous. My God, it's 50%. Oh my God, I'm going to have a heart attack tomorrow. You know, it gets you all worked up, and the yield is so small, it is not worth getting that done unless you have symptoms. Now, I told you symptoms in the carotid artery, you'd have like a TIA. Well, the symptoms in the chest, you would get short of breath and you'd get some chest pain with exertion. When you rest, goes away. Then you definitely need to talk to your cardiologist, get your scan done then. That's when it's absolutely necessary. Get an angiogram done of that heart as well. Should you get a chest x-ray? Because, you know, what if they picked up an incidental lung cancer, for example? Well, should you get the chest x-ray annually? No, of course not. But you should get a chest x-ray. Usually they say you should get it about age 55 or so. But it's even better if you can get one of these low-dose CAT scans. The low-dose CAT scan has a definite indication if you are a smoker, at least a 30-pack year smoker. And you should get it at age 55 on an annual basis, a chest x-ray, because you're not going to have symptoms from that lung cancer until it gets to a decent size. Okay, so that's the lung cancer. What about congestive heart failure? Wow, there's a lot of people who have congestive heart failure. And there is a particular protein that gets released from the stretching of the heart muscle, which is what happens with congestive heart failure. The heart stretches abnormally, and it doesn't squeeze out all the blood anymore. So that is usually the symptoms from that are you get swelling in the legs, shortness of breath, and you may even get a little bit of chest pain. So should you get that, what's called the BNP test, the beta type natriuretic peptide, that's the hormone, or that's the protein that's released into the bloodstream with a stretching. So only when you have symptoms should you get something like that. TB skin test. When should you get your TB skin test done? Well, the old PPD test, that's been around for decades. The old PPD test takes a little, PPD stands for purified protein derivative. It's a little derivative of the mycoplasma, the tuberculosis, and that, if it's positive, it's usually about anywhere from 5 to 15 millimeters of mercury at 48 to 72 hours. In other words, they put it in the skin itself, intradermal, and it's read 2 to 3 days later. So how good is that? Well, people who come from other countries, which is a big indication, a lot of countries like from Africa, for example, many people are positive for their TB skin. Or maybe they had BCG, Bacillus camelus, maybe they got BCG as an infant. They will do that in these countries. They give it to try to prevent tuberculosis. A lot of people will continue to be positive after that initial BCG. That doesn't stop you from getting the PPD. Now, if the PPD, and I used to do it at St. Anne's. I had a BCG. Yep, sit down, get your PPD. And if they're positive, and especially if they're strongly positive, I would then order the blood test. The blood test is much better because that will be positive regardless of whether you had BCG or not, if you have either latent or active tuberculosis. And so that's the TB skin test. So who gets TB skin tests? If you have a contact with any patient who has had tuberculosis, if you're from one of those countries, high-risk countries for tuberculosis, or if you work in a high-risk setting. For example, as doctors, we had to have our PPD on an annual basis. So all those are reasons for getting it. Okay, what about diabetes? When should you start worrying about that? Well, obviously, if you have a positive family history of diabetes, you start at a young age. You should get not only your blood sugar done, and it should be fasting, and you should get your hemoglobin A1C. Now, what the heck is hemoglobin A1C? Glucose, the sugar, when you have an excess in your bloodstream, it gets deposited onto your hemoglobin in the red blood cells. And so it stays on there for a period of time. And so if you have a high hemoglobin A1C, that is an indication that you have diabetes. And that will stay high for several months. So that's a good screen, the hemoglobin A1C for diabetes. Okay. So the USPS, they're the ones that say you should get it routinely without a negative family history. Get it every year after age 35. Okay. What about pap smears and HPV? Okay. The College of Surgeons say that between age 20 and 29, you should get it about every 3 years. Get your pap smear and HPV smear. And 30 to 65, you should get it every 3 to 5 years. Over 65, don't even bother anymore. Baloney. That's the old prejudice against the elderly again. And that's one of my pet peeves at any rate. Okay, men, when should you get your PSA done? College of Surgeons say you should get it done somewhere between the age of 50 and 70, and that is a hormone that goes up with cancer of the pancreas, cancer of the prostate. If you have a normal PSA, you don't really need to get it every year. But you do need to get it, say, every 5 years. But, again, over 75, they don't recommend it again. Again, prejudice against the elderly. Oh, isn't that something? What about bone density? Oh, that's a big thing too. You know, get your bone density done. Get your DEXA scan. That's a low radiation type of X-ray, and they usually do it on the hip or on the spine, and some of them may even be doing it on the heel. So, and usually the negative values, what they do is they take a standard deviation from a normal amount of calcium in the bone, and if there's less than one standard deviation, it'll be positive. They'll allow you one way or the other. Okay, so that's the bone density, and it's recommended generally in men over age 80 and in women over age 60. Should you get an EKG or a stress test? Again, depends on whether you have symptoms or not. If you've had either an irregular heartbeat in the past, or you have shortness of breath or chest pain, by all means, you need to get that EKG. Probably you'll need a stress test. And they usually will do either or even both, an exercise stress test. They do that, they call that an exercise tolerance test, or a nuclear scan. So it depends on whether you can go on to that treadmill or not with the exercise tolerance or not. So, and they will image the flow. So only if you have symptoms. Should you get your STDs checked? Only if you've been exposed. Now, if you're routinely going to see a prostitute every week, yeah, I'd definitely get it done, man. But if you're in a monogamous situation, your wife is fine, hey, why do you need an STD test when you don't have symptoms? Now, if you got the drip, well, yeah, I think you probably should get it done. Okay. But these STD screens are on the market. You can buy them. They will test you for 7 different STDs, 7 different ones. Everything from syphilis, gonorrhea, chlamydia, trichomonas, herpes, HPV, they'll check them all. Now, the latest thing is this genetic testing. Should you, if you're a woman and all, should you get your BRCA, BRCA? That's the breast hormone gene. That's the breast gene. So you have 2 BRCAs, 1 and 2, and if you have a positive family history of breast cancer, you definitely should get that done. If you have a negative and you have a negative breast examination, you don't need to have the BRCA done. Just drive you nuts. Do you need to also get those tumor blood markers? No, unless you have the tumor, you don't need to have that marker done. Like, say, the beta HCG for choriocarcinoma, CEA for cancer of the colon, PSA. You don't need those things done unless you have the disease itself. Should you get a body composition scan? Now, it's only the bodybuilders who get this. They measure the amount of fat you have in your body as opposed to the muscle mass, as opposed to the bone. Now, otherwise, you don't need to spend a couple $100 to get a body composition scan to see how much damn fat you have in your body. You just look at them, for God's sakes. Weigh them. You don't need to go and get all of these composition scans done. It's ridiculous, totally ridiculous. So, at any rate, that's a little bit about the screening, and I'm sorry I moved so fast, but we had a lot to cover, and by God, we got most of it done. This Dr. C, have a nice day.